Good morning. My name is Byron Jones. I'm a board-certified physical medicine and rehabilitation specialist in Denver, Colorado, and I've been in practice a little over 31 years. My patient population consists of complex musculoskeletal and neurologic conditions, but increasingly I'm being asked to see patients who have been diagnosed with long COVID syndrome. I've had some frustration, as have patients, in terms of lack of response to the more traditional treatments we've employed up to this point. So in my patients who present with signs and symptoms that are compatible with long COVID syndrome, I will start these patients on Formula C as an adjunctive part of their multimodal, multidisciplinary treatment regimen. Before starting a patient on Formula C, I ask several screening questions. First is, are you allergic to hemp? It would be a contraindication to using Formula C. Secondly, are you drug tested as part of your employment? Because Formula C does contain trace amounts of CBD and THC, the recommendation would be to contact the HR department at your workplace to see what their policy is. And thirdly, are you planning on becoming pregnant, or are you pregnant? We would recommend not using Formula C in that circumstance. However, having said that, if a patient is interested in pursuing this treatment anyway, I recommend that they talk it over with their OB and having in writing that they are on board with using Formula C. So I've decided that I'm going to start patients on Formula C. How do I dose it? How do I titrate it? Patients should be started on 0.25 ml or a quarter dropper twice a day. We continue that for 3 days. If the patient is tolerating it well, we're going to bump it up on day 4 to a half a dropper twice a day. We will do that for the next week. Again, ask the patient how they are doing. If they are tolerating it well, bump it up to 3/4 of a dropper twice a day. Do that for a week, and at that point, if they're tolerating it well, go up to a full dropper twice a day. Let's say the patient is not tolerating a dose well, and let's say it was half a dropper. You can ask them to decrease it by 50%, so split the difference between the 0.25 and the 0.5, so they would take 0.375 ml twice a day. So it's important to emphasize that this product is given sublingually. Why? Because the greatest degree of absorption and efficacy of the product will occur sublingually. If you were to swallow this, it will be denatured and rendered largely ineffective. We like patients to do this without any other fluids or food in their mouth, and they should hold it under their tongue for 60 to 90 seconds. Patients that you start on Formula C will receive automated emails walking them through dosing and titration recommendations, as well as any other information that might be necessary. Formula C should be stored in a refrigerated environment, but if a patient needs to go on a trip, as long as they keep it out of direct sunlight or high heat, they'll be fine. How long will my patient need to be on Formula C? Most patients on Formula C will need to be on it for a few weeks before they see improvement in their symptoms. While it's somewhat variable, most patients will be on it for a few months and then can titrate downward from there. Because Formula C is a full spectrum formulation, it will have a certain distinct taste and smell that some patients might not find desirable.